We'll start the session as some more people join in. That would be very great. So let me move on to the next slide so you guys can, like, today's session is about protozoa. Recently we studied about introduction to parasitology, what's the parasite, medical parasitology, and its classification in detail. In today's session, we'll be looking at protozoa, its different types, and we'll specifically focus on Entamoeba histolytica. So we've got a question in the comments that is Gayana Das is saying, best books for paramedical microbiology. Okay, well, there are many medical books you can use. The one I prefer to use is Medical Microbiology and Immunology by Lange. Another book is Medical Microbiology Made Ridiculously Simple. That's also very good. You can also go for Lippincot's Microbiology. I've got some detailed videos on these these kind of books, like which books you can use for microbiology, so please browse the channel. Okay, now we are going to start the session. If you've got any questions, you can in the comment section. I'll be more than happy to answer them. So let's start with protozoa. That's a type of parasite. Parasite actually has two types. One is protozoa and the second one is metazoa. Protozoa are the unicellular organisms. That means that they've got just one cell in their body. They are just one-celled organisms, right? And they've got no cell wall, but when there are certain harsh environmental conditions, they form cysts in those conditions to survive. Cysts are round and spherical in shape, and they've got hard outer membrane that protects them against the environmental conditions, like if there's desiccation, if there is very hot temperature, like some people are using disinfectants to clear the surfaces in their home. So parasites might need to form cysts to protect themselves. One of the examples of protozoa is Entamoeba histolytica. We've got other parasites like Giardia, Lamblia, Cryptosporidium hominis, but today we'll be focusing on Entamoeba histolytica. As in this picture, you can see Entamoeba. All right, moving on to the classification. If you've got any questions about the introduction to protozoa, please, you can ask in the comments. We've got a question from Steven. Will you host one on bacteriology as well? Yes, of course, I'll do that in future after the completion of all the bacteria videos on YouTube. Some of them are left, so I'll try my best to complete them as soon as I can, and then I'll host them. Next, we've got a question from Gyan Das. Ma'am, can you please provide the same PDF, please? Of course, I will. Please send me a reminder on my email address that I've mentioned in the comments. So I'll definitely send you them. Then we've got another question that is from Study Hour. Want these slides, ma'am, please? Of course, send me a reminder and I'll send you them. Okay, let's start with this slide. That is the classification of parasite, as I told you a little in the recent slide. So now we're going to focus it on in little more detail. That is based on movement. We are talking about the protozoan classification that is classified into amoebas. That is Sarcodina, as I've got a little cute amoeba right there, this orange one, if you guys can see. It is also classified into sporozoa, that these are the spores ones. It is also classified into mastigophoras, like flagellates. They've got flagella. Amoebas actually have pseudopods with them, Sarcodinas amoebas, right? And the sporozoan have got no motility apparatus that can help them to move. So this means that they are immotile. Mastigophora, they are flagellates. It means that they've got a flagella. You can see Giardia lamblia, and it has got the flagella with it. So this flagella helps it to move. The last one is ciliata. It has got cilia with it, and these cilia help this organism, this parasite, to move. Right, so this was the classification based on movement. If you've got any question about that slide, please ask. Next slide is about the classification based on regions, but I'll wait a little for you guys so you can ask me a question about classification based on movement. Right, on the basis of movement, the parasite is classified into 4 Sarcodina, that is amoebas. Right, I think nobody has a question about the classification of parasites based on the movement. I'll show that. Want to ask a question by looking at the slide. That would be a little more easy for you. Or you can ask any other question if not related to this slide, if it is generally related to parasitology, that would be great. Okay, we've got Gyana Das is saying, okay, everything's clear. That's very nice. We're moving on to the next slide. That is the classification based on regions. Regions means the site of action where the parasite causes infection, right? So parasite actually causes infection in different body parts, starting with intestine. So these will be called intestinal parasites. With urogenital tract, they will be called urogenital parasites. Then those causing infection in different body tissues, they are termed as tissue parasites. And lastly, those cause infections in blood are blood parasites. Is that clear to you all? Or I need to explain a little more about that? Or if you've got any questions, please ask. Is that clear? I guess that's clear because nobody asked any question about that slide. Okay, moving on to the next slide. That is Entamoeba histolytica. So now we are going to officially start the topic of today's session. Gyana Das is saying everything's clear. That's very great. Okay, Entamoeba histolytica is responsible for causing 2 major diseases. First one is amoebic dysentery, and the second one is amoebic liver abscess. We'll be talking about these diseases in very detail in pathogenesis section, but now we're going to talk about the characteristics of the Entamoeba histolytica. Entamoeba histolytica is an intestinal protozoan. This means that its site of action is intestine. It will invade the intestinal epithelial cells and it will cause the infection there. And it will also multiply in the intestine. The second characteristic is it's a motile parasite. Every parasite has got 2 stages in its life cycle. One is infective stage, when parasites infect the host and cause disease in the humans. And in case of Entamoeba histolytica, this stage is trophozoite. And the second stage in the life cycle of parasites is the diagnostic stage, where we identify the causative agent in the patient that is responsible for causing the infection. In case of Entamoeba histolytica, that is the cyst. And cyst of the Entamoeba histolytica has 4 nuclei in it. This is a picture of the trophozoite of Entamoeba histolytica. It moves with pseudopods, that's why it is motile. And it is irregular in shape. It has got different organelles in it, like the mitochondria, Golgi apparatus, and its others. But the cyst is circular in shape. It has got a rigid wall around it that makes it resistant to environmental conditions. That's it for this slide. Is this clear to you all? If you've got any questions, feel free to ask in the comments. I'll be more than happy to answer you. I guess this is clear to you all because it was, I think, quite easy. Entamoeba histolytica has got 2 words in it. First one is Entamoeba, that's its genus name. And the second one is histolytica, that's its species name. And as I mentioned in my recent session, that the letter, in this case, that's the capital genus. And the species name always starts with a small case letter. And in that case, that's histolytica, so it starts with small h. Is that slide clear to you all? Or if you've got any questions, feel free to ask in the comments. I think that slide is clear, so I'm moving on to the next slide, and that is about the life cycle of Entamoeba histolytica. As I mentioned a bit earlier, every parasite has got two stages during its life cycle. One is the infective stage, that is trophozoite in case of Entamoeba histolytica, and the second diagnostic stage, that is cyst in case of Entamoeba histolytica. So the life cycle, see it like a story. The life cycle of amoebiasis disease caused by Entamoeba histolytica, and its life starts with the cysts being ingested by humans. These cysts travel down to the intestine, the small intestine, and then they insist there, and they release the trophozoites. Trophozoites multiply there and they cause infection in the intestine. Trophozoites then pass colon and multiply there. Cysts form in colon and then they're passed in feces. Those feces, this infection, the amoebiasis, is transferred to the other humans. Ghana Das is saying cyst. I didn't get that. If you've got a question, so please write it in more detail. So I'll get that and I will answer you definitely. If you've got any questions about the life cycle, do ask. Like human will first ingest the cyst. That's the diagnostic stage. That will go down to the intestine, the small intestine. There it will encyst and will release the trophozoites. Trophozoite is the motile, the infective stage of the Entamoeba. That will cause infection in the small intestine. I'll be explaining how it causes the infection in the pathogenesis a little later, but for now, focus on the life cycle. It will then multiply in the colon and will pass in the feces. It will not pass, its cysts will be passed in the feces, right? Is that slide clear to you all, or do you have any questions about that? Ghana Das is saying, ma'am, 2 stages, cyst and trophozoite. Yep, there are 2 stages. One is the infective, that's the trophozoite, and the second, the diagnostic, that's the cyst. Why we call the cyst the diagnostic stage? Because it's released in feces, and in lab diagnosis, we collect the sample of feces and we see it under the microscope. So that's why it's called the diagnostic stage. And trophozoite is actually responsible for causing the infection in the intestine. That's why it is called the infectious stage. Is that clear to you now? If it's not clear, you can ask the question. Please write it in a little more detail so I can get what your question is. Okay, so till you're asking a question, we'll focus on the Entamoeba histolytica. This organism is transmitted by the fecal-oral route and by ingesting the food that is contaminated with the human feces that contains the Entamoeba histolytica's cysts. And if we talk about the habitat of Entamoeba histolytica, there is no animal reservoir, right? It only has human as its host. Is that clear to you now? And the site of infection in the human for Entamoeba histolytica is its small intestine. Is that slide clear to you all? And do you have any questions about the life cycle of Entamoeba histolytica or its introduction or anything else? Or you guys can also ask some general questions like when I'm going to start, which series, like what kind of books are recommended for which subject or topic, or you can also introduce yourself in the comments. If you've got another comment, that is, I'm sorry if I'm not pronouncing your name correctly, Maru Siboka is saying thank you for your efforts. Thank you for joining this session and for liking all my videos. Okay, he's again saying hi, hello, how are you doing? And then we've got Kiana that's asking, what is habitat? Habitat is actually the place where the parasite is living and the place where it causes infections. In my recent session on Introduction to Parasitology, I've explained habitat and hosts in very detail. If you want detail, you can watch that session, but for now, understanding the life cycle, it is like you can consider it as a home where a parasite is living and it gets out of its home and it moves somewhere else and it causes infection in somebody else's house. So that's its host. Habitat is where it actually lives. That's simple. Okay, is that slide clear to you all? If you've got any questions, you can ask me in the comments. I guess that's clear because I've got no more questions. The next slide is about the pathogenesis. Okay. As I've said, Entamoeba histolytica is acquired by eating food contaminated with human feces that contains the cysts of Entamoeba histolytica. And then these cysts encyst in the small intestine and they release trophozoites. Trophozoites do what? They invade the colonic epithelium. How do they invade it? They secrete enzymes that cause localized necrosis. That also leads to little inflammation at the site of the infection. And then when the infection reaches the muscularis layer of the intestine. Okay, first let me explain that how many layers an intestine has. There are actually 5 layers in the intestinal wall. Most is mucosa. On top of that is submucosa. The third one is muscularis. On top of that is serosa. And the outermost layer is adventitia. So when the infection or the invasion of the trophozoite reaches the middle layer, the third layer, that is muscularis, there it forms a typical flask-shaped ulcer that can undermine and destroy the large areas of intestinal epithelium. Is that slide clear to you all? We've got a question from Nazma Tasty Tricks. Your lecture is brilliant, ma'am. It has been so helpful. Thank you so much for your kind words. I really appreciate that, and I really appreciate your interest in my videos. Then we've got a question from Adi. Ma'am, how to pass second year of MBBS? That's very great that you're in second year, you've passed your first year and you want to pass your second year. You can use books that are high yield books. Like there are certain books that have got too much detail and there are some books that have got really important things mentioned in them, not too much detail. So I would prefer you use those books. I've got some videos about different books on my channel. You can watch them and you can use different techniques that will help you pass your exam. Kiana Das is saying that's clear. That's very great. If you've got a question, you can ask that. Okay, moving on to new pathogenesis. We were talking about ulcers that forms in the muscularis layer when the trophozoite causes an invasion or causes the infection. When the trophozoite reaches the submucosa, the innermost layer, the second innermost layer, it causes infection there. It can then lead to invasion of portal circulation by trophozoites. If I say portal circulation, that is related to liver. There we can say that Entamoeba histolytica is now going to cause a systemic disease in liver, and that is termed as amoebic liver abscess. It will cause abscesses in the liver, and these abscesses will be filled with what? The trophozoites of Entamoeba histolytica. And diseases caused by Entamoeba histolytica has different symptoms. Like if it is amoebic dysentery, it is bloody and mucus containing diarrhea that has symptoms like lower abdominal pain, flatulence, and tenesmus. If you don't know what's tenesmus, you can ask me, and if you know, that's great. Okay, I'll tell you. Tenesmus is the feeling continual or recurrent feeling to evacuate the bowel, because this is a diarrheal condition, so it is related to the evacuation of bowel. And in liver, as I said, it causes abscesses and lesions. So these lesions, the granulomatous lesions, are called amoeboma. And the first primary disease caused by Entamoeba is the amoebic dysentery. And when it spreads to liver, it causes amoebic liver abscess. So we can say it's systemic complication. Is that slide clear to you all? If you've got any questions, please ask. I'll wait for a second. If you guys have got any questions, you can ask me in the comments. Adi, ma'am, your lecture was so helpful for representing my seminar topic on ascariasis. That's very great. I'm so happy. So how was your seminar? Did you explain really well? I think it was, as you said, helpful, so it would be great, and many people have appreciated you for that. Okay, I think this slide is clear to you all. I'm moving on to the next slide. That is about the lab diagnosis. Don't worry, I'm going to have a Q&A session at the end of this video, so you can ask any questions about parasitology in general or medicine, like how to pass it, which books to use, and stuff like that, okay? Let's talk about lab diagnosis. As amoebic liver as amoeba is Entamoeba is responsible for causing amoebic dysentery, that is diarrhea. So we'll need the sample of stool that contains the cysts and sometimes the trophozoites. Then we'll take that for microscopy, and under microscope we'll see the trophozoites of the Entamoeba histolytica that will be moving with their pseudopods, and they will be irregular in shape. And cyst will be circular, will have a resistant circular wall around them to protect them against the resistant conditions. And we'll also go for serologic testing. Serologic testing is actually done to check the antibody count against the infection caused by any parasite, bacteria, virus, or others. So how it works? It works by taking a blood sample and then test it against the antibodies present in the blood. If the antibody titer is more than the normal, then we can say that a certain disease is caused in the patient and caused by this parasite. Okay, we've got a question by Study Hour. Ma'am, your lectures are so helpful for us. Thank you so much. I really appreciate that. That slide clear to you all, or if you've got any questions, you guys can ask me. So I think I've got no questions about the recent slides, so let's start with the prevention. Entamoeba histolytica causes infections, and we need to prevent Entamoeba histolytica from causing infection by doing certain measures. Number one is hand washing. Good personal hygiene can help us prevent the infections caused by Entamoeba. The second one is water purification, specifically the water that is supplied to the houses in different societies that needs to be purified. So the outbreaks of amoebiasis is areas. And then we need to properly dispose the human waste, because the human stool has the cyst in it that causes infection. The cysts need the human wastes are need properly, I don't know, I'm slipping my tongue so much. So we need the proper disposal of human wastes. And that was the last slide about today's session. If today's session or the recent session or in general to parasitology or any other medical topic, you can ask me. If you've got any suggestions, what kind of topics I'm supposed to do in the future, or what kind of medical related stuff I need to put on my channel, like the equipment review, like I did one on the strip thermometer and the pulse oximeter and other things, you can ask me clearly. Adi is laughing at, thank you for laughing at slipping my tongue so much. I don't know why I slipped it, I might got confused a little. That's okay. So Gayana Das, you are still asking which country am I from? So you can check that on YouTube, guess that, which country is that, and tell me in comments. Okay, tell me which country are you guys from? I'll be really happy to know, all of my students. So let me ask you guys a question and you should answer me in comments. Tell me what's the difference between a parasite. Okay, Gyana Das is saying America and I'm from India. Okay, are you from India? That's very great. Okay, I was asking questions, sorry I interrupted. What's the difference between the parasitology and medical parasitology? There's a slight difference and that's very important. Okay, go ahead, answer my question. Oh, I forgot to tell you something, that is I've got a table of contents for all of these parasitology sessions. I'll be doing session on each parasite and I'll let you know on my Instagram. If you haven't followed me on my social media, you can follow me on my Instagram and Twitter. Both are with the handle medzukhruf, MED and ZUKHRUF. You know the spelling, I know. You can follow me there. I'll post about the sessions prior to doing the session, and I'll also post that on YouTube. So you get to know. I've mentioned my email address in the comments. You can send me a reminder about the table of contents of all these sessions and the PDFs you guys want. So Gayana Das is asking my Insta ID name. That's medzukhruf. You can search it on Instagram and you'll get that. Okay, if you've got any question, you guys can ask me. I know you might have questions about bacteriology, like some one of you recently asked about bacteriology. Let me see, what was that question? Like, when will you host one on bacteriology? Okay, so I'll be doing that very soon. You can ask questions about bacteriology, mycology, or anything else. I'll be more than happy to answer your questions because that is Q&A session time. Okay. Are you guys students or professionals? Like, have you completed your degrees, graduated, or what? You can tell me in the comments. That would be very great. And nobody answered my question that I asked, that what's the difference between parasitology and, not and, or, and medical parasitology. Okay, I'll answer that question. The difference between the parasitology and medical parasitology is that we study all the parasites in parasitology, and we study parasites that are related to humans in medical parasitology. That's the difference. Gyana Das is saying, just completed my DMLT. That's great. Adi, I'm a student. Oh, that's nice. Best wishes for your studies. Okay, anyone else? If you have any question related to parasitology in general or anything else, you can ask me. I'll be happy to answer. Adi, where are you from? Can you tell me? Gayana Das has told me that the place of the country, that's India. What about you? What about all the other students? Where are you guys from? Are you guys students or graduates? What are you doing? Are you practicing or just doing nothing? But I would be happy to connect with you guys. Adi is saying from India. Oh, that's very great. I think half of my audience is from India. I'm so happy and even excited. That's very great. I've started my mycology series on my channel. I hope you've watched it. First video, Introduction to Mycology. So I'm releasing its other videos very soon. And I have recently published a book on medical parasitology MCQs. That's an ebook, and that's available on different platforms. If you want them, you can email me. I'll send you all the details and you can purchase it. And I've released two of my handouts. One is on parasitology. I know you guys might have studied them. And the other one is on bacteriology. The general bacteriology handouts are released, but we need to you guys need to wait a little more for clinical bacteriology handouts, because I'll release them as soon as the videos on YouTube are completed. I've got another question. No, that's just an information, not a question. Gayana Das is saying, I'm not studying in BPharm. That's very nice. Best wishes for your studies. Adi is saying, ma'am, what's your education? What do you think? Am I a student? Am I a graduate? What have I done? Okay, I think this you guys got no other questions. Is that what I'm understanding, or am I wrong? If you've got any questions, you can freely ask me without hesitation. I'll definitely reply to you. Okay, so Gayana Das is saying a graduate. Yeah, I am a graduate. Maybe a student. Yeah, humans are always students. From when I started this channel when I was a student, but now I am a graduate. Okay, so if you've got any questions, you can ask me. Okay, let me ask you another question. Tell me the full name of Giardia. That's a really easy question. I know you guys can tell me. You've got 5 seconds. I'll just say I'll just count from 5 to 1, and you're supposed to answer the question. Write full name of Giardia in comments. 5, 4, 3, 2, and 1. And nobody answered the question. Guys, come on, that's Giardia lamblia. That was too easy. Okay, let me ask you another question. What's the difference between amoebic dysentery and amoebic liver abscess? That's a little tricky question. So you're supposed to tell me in detail at least 4 points about each of them. Adi is saying don't know and laughing. I don't know what you're talking about. Are you talking about Giardia? Okay, that's very easy. That was Giardia lamblia. Okay, tell me what's about amoebic dysentery and amoebic liver abscess. Okay, I'll tell you. Amoebic dysentery is a disease caused by amoeba in the small intestine, that its primary site of infection. And amoebic liver abscess is the systemic infection that is caused after the dysentery, and it is caused in the liver, where the Entamoeba histolytica's trophozoites form abscesses, and those abscesses are filled with trophozoites. So, but just tell me, that would be really great to know. Adi is saying, I'm in 2nd year, but still I haven't touched the book. No problem, you can touch the book now. Start studying. Spare 1 or 2 hours a day and study. Microbiology, that's very interesting. Other subjects are interesting too. Guyana Das is saying diarrhea. Is that diarrhea? Am I reading it correctly, or is there something I'm missing? I don't know. Please write it completely so I can read it. Anybody else? The diarrhea, bloody and mucus containing diarrhea. Very good. That's very great. Okay, tell me other symptoms of amoebic dysentery. Other symptoms are very easy. Like another symptom is abdominal discomfort. I told you. Now you guys can tell me the remaining symptoms of amoebic dysentery. Okay, I'll tell you. Another symptom is flatulence, and another one is tenesmus. I told you guys what is tenesmus. Now you are supposed to write that in comments. What is tenesmus? I'll give you 5 seconds to write it quickly and I'll read it. What's that? You've got 5 seconds, guys. Tell me, what is tenesmus? Okay, I'm asking you a question in the comments. What is tenesmus? Okay, here you go. Reply to my question. What is tenesmus? You are supposed to tell me. Okay, I'll give you a hint. That is related to evacuation of bowel. That was a big hint, guys. Come on. Now tell me, what is tenesmus? I told you during the session, and now it's your turn to answer the question. Tenesmus is a continual or recurrent feeling to evacuate the bowels. Is that clear to you guys? I hope that is. If you've got any other question, you can ask me, or if you want to introduce yourself, if you want to suggest to me anything about my channel in general, or what kind of videos should I upload, or anything else, you can tell me in the comments. I'll be more than happy to look at your suggestions and take one of them seriously if they were good. Definitely, I'll do so. Okay, I think I need to ask a few more questions from you guys, and then we'll officially end the session. Tell me, did I tell you guys the symptoms of amoebic liver abscess? I think no, I'm supposed to tell you. Amoebic liver abscess has symptoms like the right upper quadrant pain, because liver is situated in the area that is the right upper quadrant, right? And it also has symptoms like weight loss, fever, and on inspection and palpation, we'll see tender and enlarged liver. Why the liver will be tender and enlarged? There is a big reason, and that is there are abscesses inside the liver, and those abscesses are filled with the Entamoeba histolytica's trophozoites, and because of that, liver is tender and enlarged. Okay, I told you the symptoms of amoebic liver abscess. And is Adi has a question, ma'am. Why we ingest barium emulsion to worm? Do we give barium emulsion to worm, or do we give it to a person that contains a worm, the metazoa in its body? Would you please write it in a little more detail so I can get that, and then I'll reply to you in a more detail. I'll reply you in detail. I don't know why I slipped my tongue so much in today's session. I usually don't do so. I talk fluently, but when I slip tongue, that's okay. Even legends make mistakes, so that's okay for me. Okay, Adi, please write a detailed question. Is there anybody else who wants to ask a question? Or should I go and ask you a question? That would be great, I think. Did you guys answer all of my questions that I asked, like the difference between parasitology and medical parasitology, a difference between amoebic dysentery and amoebic liver abscess, what is tenesmus? Okay, let me ask one more question from you guys, and I'll get to know you about your knowledge, like how much you've gained from today's session and how much is left. Okay, tell me why we need to dispose human wastes in order to prevent the infection caused by Entamoeba histolytica. There might be some logic behind it. Okay, tell me why we go for proper disposal of human wastes for preventing the Entamoeba histolytica's infections. Okay, we've got another comment. Adi is saying, ma'am, you explained very well. I always to you for my doubts. That's very nice of you. I'm happy that I answered your question well. If you've got any question, you can ask me and answer my question. I'm asking you guys questions and you don't answer my questions, and that's not good. I'm waiting for your answers. Okay, we've got another comment. Lamek Manjolo. I'm sorry if I'm not pronouncing your name correctly. My name is Lamek. Now I'm in my 4th year of medicine from the University of Zambia. That's nice. Used your recorded videos last year for my microbiology exams and I passed. Thanks so much. Thank you. I'm very happy to hear that you passed your exams. That's very nice. And best wishes for your studies ahead. Okay, you can also answer my question. That was why we dispose human wastes in order to prevent Entamoeba histolytica's infections. There is a big reason behind that, and those who attended the session from the beginning know the answer. Come on, guys. Why I'm slipping my tongue time and again? That's okay. Come on, guys. Tell me what's the reason behind it. I'll give you 5 seconds to answer the question. I'll count from 5 to 1. I'll do backward counting, and you're supposed to answer the question in that time, okay? 5, 4, 3, 2, 1. Ta-da! Nobody answered the question. Oh, we got an answer. That's from Adi. To avoid the contamination. Awesome. That's really good. That's correct. Because human feces has the cyst and sometimes the trophozoites that are responsible for causing the infections, and we need to dispose them properly to avoid the contamination of food or water with them in order to avoid the infection. Well done, Adi. Okay, one last question that I ask you, and that is going to be about Entamoeba. Or should I go for the question about other parasites? But we are going to discuss other parasites in our upcoming sessions. Okay, tell me about the hosts of Entamoeba histolytica. Do we have any animal reservoir for Entamoeba histolytica? Or we don't have, or we only have human, or we have some animals? Tell me, guys, in the comments. I'm waiting for your answer. Is there any animal reservoir for Entamoeba histolytica, or there is just human? If there is an animal, which animal? Like, is it a cattle? Is it other animals like horses, or what? Tell me in the comments, guys. You've got 5 seconds. I really like to do that game, like count backwards and ask a question for my students. Okay, I'll tell you the answer. There is only human reservoir for Entamoeba histolytica. There is no animal reservoir for that. Okay, we need to know about the parasites, like what kind of hosts they have and what is your habitat and transmission. This is the primary thing that we need to know about the parasites, because it is very handy when we are in our clinical rotations. We need to know about the symptoms as well, because they help us diagnose the disease very well. Another comment is by Adi, Stia fly. Well, no. Entamoeba histolytica only has human reservoir. There is no animal reservoir. I know that's clear to you now. Okay, anybody else who wants to ask a question, ask me, and then I'll end the session very soon. It's almost 10:53 p.m. in my country. What's the time in your countries, guys? And if you want to introduce yourself, if you want to let me know about anything related to the channel, like your suggestions or what, in the comments, I'll be happy to read them. And if you've got any suggestions, like which video series should I start, like I've recently started mycology. I'll be doing virology, inshallah. And I do have certain videos on a medical survival guide, and I'll have videos on certain books, like what kind of books we are supposed to use for which subject, and which medical instruments we are supposed to use, like the top 5 best apps and certain kinds of videos. And if you have any suggestions for me, please tell me. I'll be more than happy. Okay, now tell me, how many of you have purchased my parasitology MCQZ book, and how was that? Adi is saying it's 11:23 p.m. in our country. Oh my gosh, that's 11:23. And ma'am, today's lecture time, that was 10 p.m. in my country, so it was in India. Let me check that and tell you. 10 p.m. That is going to be, I think, 10:30 p.m. in your country, lecture time. I recently did a lecture that was at 6 p.m. in my country, but I thought it would be better to do one at 10, so I get to know when my audience is more active and I can connect with them. I really like connecting with my audience. Adi is asking, tomorrow's lecture time. Oh, well, that will be at, I think I'll announce that. I need to now make it slides because they're not yet ready. I'll make fresh slides, and then I'll let you know in the community and also on my Instagram that when will be its time. But probably that will be 6 p.m. or maybe 10 p.m. or maybe I take it to 9 p.m. That's what I normally do. And if you've got any questions, you can ask me. I really like connecting with my students. I really slipped my tongue today, and that's bad. Okay, I think the session time is almost up, and I need to close the session. I hope you enjoyed it. I really enjoyed talking to you guys, knowing about you and answering your questions, and I hope you enjoyed it too. And see you soon in the next session, and till then, Assalamualaikum. Bye bye.